and welcome back to the Urology Care Podcast, the official podcast of the Urology Care Foundation. Our guest today is Dr. Ekene Enemchukwu, and she is here to talk about the health of Black women and what they should know to live a healthy life. Dr. Enemchukwu, thank you so much for joining us on today's episode of the Urology Care Podcast.
Thank you. Great to be here.
Can you start by telling us a little about yourself and a little bit about the work that you do?
Yeah, so my name is Ekene Enemchukwu. I'm a urology trained urogynecologist, so also known as a female pelvic medicine and reconstructive surgeon. So that's all just basically medical terms for a pelvic surgeon who specializes in women's health issues such as urinary incontinence, overactive bladder, or pelvic organ prolapse.
Great, thank you. And how do you hope that others may benefit from listening to our talk about the health of Black women?
Yeah, so, women in general are often caretakers, and we really focus on everyone else's health but our own. And for example, I can tell you how often I see women in my office suffering from bladder leaks for years and years and years, and they put it on the back burner until they, quote unquote, have time to take care of it. And so years later, they finally make it. So I think as women, as caregivers, it's important to understand the importance of self-care so that we can better care for other people and our loved ones. In addition to being caregivers, I think Black women have another layer. We deal with the intersectionality of race and being a woman, the history of racism in medicine and ongoing issues with health disparities, implicit bias, and how those things can lead to mistrust towards the healthcare system. So due to this reason, I think Black women are often at higher risk for many health issues. So as Black women, I think it's important to empower ourselves, find a doctor that you trust to help manage your health, because really, I think our lives really depend on it.
Absolutely. Thank you for that information. I think this conversation will definitely provide a lot of valuable information for our listeners. So let's start by going into when should Black women see a doctor?
Yeah. So I always joke that you should see a doctor as soon as you graduate from your pediatrician. So seriously, women need to establish care with a gynecologist and a primary care physician at a young age so that you can get on the right track with your maintenance that you need to maintain, that you need to continue for the rest of your life. So sometimes you can find a family physician that can do both, be both your gynecologist and your primary care physician. They're a specialty of medicine that care for patients from birth to end of life. And I think it's also really important that women in general understand the healthcare system and all the parts of the team, that doctors work closely with other providers such as nurse practitioners and physician assistants that help to manage your care, and also to just make sure you know who you have on your team. It's important to maintain these relationships and to maintain your routine follow-up in the same way you maintain your car, anything else that's very valuable to you. I think I have to really emphasize that there's nothing more valuable than you and your health. You are important and you are valuable.
Great. Thank you for that. And can you go into a little bit more detail about which specific checkups and screenings Black women should consider when they are recommended and why they should be considered?
Yeah, so I think to start, a yearly physical is very important. And again, that's to make sure that your blood sugars are normal, your blood pressure is normal, your cholesterol, among other things, are all in normal range. These are really the silent killers when we allow them to go outside of normal range, because often you may not have any symptoms until things have progressed. So when we talk about high blood pressure, high cholesterol, abnormal blood sugars like you would find in diabetes, these are conditions that can contribute to heart disease. And many people are unaware that heart disease is actually the number one killer of Black women. So the good news is that we can turn this around though. So through things like exercise, this does not have to be at the gym. It can be any physical activity like a brisk walk, dancing, swimming, anything that gets your heart rate up for 20 minutes a day, 3 days a week. And of course, check with your doctor to make sure that you're healthy enough to do this. But start with one day and work your way up is ideal. And it's so important for both your mental health and your physical health. And you'll love how you feel once you get that started. Diet's super important as well. And you can get help from your primary care physician. They can schedule a consultation with a nutritionist to help you get more resources and improve your knowledge in that area. Maintaining a healthy weight. This is something that many of us struggle with, but it's so important. Being an unhealthy weight can really impact our health. It can impact our blood sugars, our blood pressure, our heart health, and it can even impact our bladder health. We know that losing just a small percentage of your weight can significantly reduce your bladder leaks and incontinence episodes. And I think the other important thing is that it's, there are a lot of chronic conditions that run in our families, our family history, such as high blood pressure and diabetes. But it doesn't mean that you give up. You got to really fight to change things for yourself. And I like to give the example of my dad. He has a horrible family history in terms of some chronic conditions in his family, diabetes, high blood pressure, stroke. And I think he was really well on his way to developing them too. And he decided to really take control and fight it with diet and exercise. And now he's in his 60s and he's healthier than he was even when he was in his 40s. So you can really change the story for yourself. And finally, I just want to talk about cancer screening because it's very important. The recommendations for that are to start colon cancer screening at age 45. And this is new. It used to be 50. And we've seen young people like Chadwick Boseman die of this terrible disease. And it's really so important to maintain those relationships with your primary care physician so that we can get screening started at an appropriate time for you. If you have a family history, it may be that you need to start your colon cancer screening earlier. Healthy diet is also important. It helps to prevent many different types of cancers. And then finally, as women specifically, it's important to start your pap smears and HPV testing at age 21 to screen for cervical cancer. And let me also emphasize that this is also a terrible disease, cervical cancer, and it's preventable, which is great. So it's really important to keep up with your screenings with your doctor, find a doctor that you trust. Although many women survive cervical cancer these days, the after effects of the treatments, the pelvic radiation and other things that are required are really life-changing. And I take care of a lot of these women. And let me tell you that it's not a disease that you want or a disease that you want to progress. So really, really important to stick to those, to that screening schedule. And then finally, mammograms, those should start at 45. Again, if you have a family history or a known gene mutation, then definitely talk to your gynecologist about when your screening should start.
Wow, thank you. That was a really great overview of, everything that women should keep in mind. And so you touched a little bit on, just some daily things, including exercising that women and Black women in particular can do, to help prevent and keep their health in check. What else should Black women keep on their health checklist?
Yeah. So I'm gonna, as you won't believe that this is the first thing I'm gonna say as a urologist, but really mental health. Even as a urologist, I understand how critical it is for women to prioritize their mental health. You can't be whole, you can't be healthy, physically healthy if your mental health isn't where it should be. So I think this is especially important to emphasize for Black women due to the stigma associated with mental health issues in some of our communities. And just really understanding as well that mental health actually affects your bladder health. So if you're not sleeping well, you're not resting, you're not getting self-care, all of these things very underrated, especially in women. These things can really contribute to chronic diseases such as heart disease, again, our number one killer. So it's all connected. We need to think of things holistically. mental health, physical health, self-care, all of those things are important. And as a urologist, I think fluid intake is also underrated and very important. So I think a lot of what you drink really impacts your urinary tract, whether that's forming kidney stones, urinary tract infections, kidney cancers, and bladder cancers. So it's important to stay well hydrated with water. 6 to 8 glasses per day are probably fine for most people. I find many of my patients coming into clinic with problems with frequent urination and urgency, and I find out that they're drinking their weight in kilograms, so ounces. So if they're 100 kilograms, they're drinking 100 ounces of water. That's too much water, and that's going to cause you to run to the bathroom all the time. So really drinking to thirst is best, but if you're someone who your thirst mechanism isn't really telling you when to drink, try to stick to that 6 to 8 glasses of water per day. The goal is really to help fuel your body, keep your skin looking fresh and healthy. Y'all want that. Prevent constipation, prevent kidney stones. I mean, imagine childbirth without an epidural. It's not fun, passing kidney stones, UTIs, which are no fun either. So all this is preventable with adequate water intake. And then I think as a urologist, I would say blood in the urine is something that is important. If you do see this, let your primary care doctor know right away so that they can evaluate and have you see a urologist. Sometimes blood in the urine is the first sign of a cancer in the urinary tract. It can be something more simple like a kidney stone or a UTI, but you definitely don't want to let any of that fester. Along the lines of kidney and bladder cancer, you want to avoid tobacco. It really increases your risk for a long list of cancers, including bladder cancer, as I mentioned, but it can also really exacerbate or cause overactive bladder symptoms. So it can cause frequent urination, urgency, and bladder leaks. And it's really hard to quit. So try not to start in the first place. And if you've already started and you're having difficulty quitting, then talk to your doctor about resources available to help you quit. Again, I think all of these small changes that we can make in our routine and in our lives, they all really matter, and your life really depends on it.
Thank you. And I appreciate what you said at the beginning of that about mental health and how mental health really does affect your physical health. I think that's so true. And it's so important for people to know that, taking care of your mental health and your mind plays a huge role in your physical health as well. So thank you for talking about that. So, with your professional experience, do you have any final thoughts on or insight on what Black women should know to live a healthy life?
I would say number one on my list, and this is very tough, but I'm working on this for myself too, is self-care is really important. You can't care for others unless you care for yourself first. You're valuable, you're important too. Your health is important. And so I think that's really important. And then as we just said, mental health is part of that. So really maintaining that is really important. Diet, exercise, sleep. Can help maintain mental health. But for some people, they need more than that. And you shouldn't feel embarrassed to seek out help, see a professional. It's about time we break the stigma. We all deal with mental health issues to differing degrees. So ask your doctor to help and to set you up with someone who can help. I think empowering yourself through knowledge about your health and your healthcare team is really important. Empower yourself using a reputable source. So usually not Google, Facebook, but find someone that you trust that's trained in this area that can point you towards reputable sources. Find a provider that you trust to help you maintain your health. These relationships are really important and can be often lifelong, build them over time. So it's a really important relationship to invest time in. And then finally, don't give up. Your health matters. Your health is very important. And again, I think I said it before, your life depends on it.
Thank you. I agree with everything that you said completely. And I think our listeners will really appreciate all of the information that you shared today. And Dr. Enemchukwu, thank you so much for joining us on today's podcast.
Thank you. So happy to be here. And thanks for the invitation.
These resources were created in part due to a charitable donation from Astellas. This podcast has been brought to you by the Urology Care Foundation, the official foundation of the American Urological Association. For more information on today's topic and for all things urology health, visit urologyhealth.org. That's urologyhealth.org.